This is the Astral Radio Network and the Dr. Don Show. It's your health, it's your life. Now, back to the show. Here's Dr. Don.
Thanks, listeners. It's Labor Day, and we want to recognize the labor movement for its contributions in our healthcare. Employers, government, WorkSafe BC, everybody's doing their part, and no less the BC Federation of Labor and its president, Mr. Jim St. Clair. So on this second part of the show, we're still talking, I should say, with registered massage therapist Anders Lau, and we're talking about massage therapy and your pain. So if you have some questions for Anders tonight, I would encourage you to call us at 604, in the Vancouver area, 604-280-0650, and long distance toll free to any of the regarding any of the massage therapists throughout British Columbia. It's 1-877-280-0650. Also, if you're watching us on the internet, there's a bit of a wave to you. And the email address for emailing us questions is radio, R-A-D-I-O, radio at bcchiro.com. So we were talking with Anders prior to the show about some of the various things that he's done and his colleagues are doing. Anders, you noticed that there's some different attitudes in the Lower Mainland, and this is your experience from treating people in these geographic areas, and you can tell our listeners which parts they are. And I'm curious to see what it is you noticed about the attitudes of people to health. So first of all, what are the three areas?
The three areas that I work as of right now are North Burnaby, right near the Lougheed Highway, New West, actually right near Royal Columbian Hospital, and thirdly at West 4th and Alma, so sort of quite near the UBC Kitts Beach area. And the thing I've noticed about these three different areas is...
Now, you're not going to upset your patients when you tell us this, are you?
I don't think so.
Good.
I don't think so. I'm pretty confident. I enjoy working in those three different environments as they give me completely different insights into the way that certain sets of, or certain demographics of people approach their health. That is to say, there are certain subsets, for example, in the Vancouver area, in which health is as important as eating, where they'll portion up a portion of their budget is considered part of their health care.
Really? Good for them.
I'd say so. It's absolutely great to hear. And in some ways, they're so forward-thinking about their health that they're the ones telling me about this brand new exercise
Okay, so that's
technique.
kind of like the Vancouver area.
The Vancouver
So take
area.
us to New Westminster Burnaby now.
Well, New Westminster Burnaby, some of those ones, you have people who have an idea of how to stay healthy. They know about yoga. They might have heard about CrossFit or those other sort of, I won't call them fads, but they might have heard about those high-intensity activities. But they're not always completely sure on the nuts and bolts of their health and what exactly is chiropractic, what exactly is naturopathic, and those different sort of ideas. So they have an idea of what they're supposed to do, but they couldn't tell you if you asked them on the street exactly what they're supposed to be doing for their health.
So we've got budget-conscious people in Vancouver planning for their health. Mm-hmm. We've got a group in the New Westminster Burnaby area sort of wondering and wanting more information. Mm-hmm. So what's happening over in the Kitts area?
Well, in the Kitts area, that was the portion of people who are budget planning.
Oh, okay.
We should clarify.
All right.
So in the Kitts area, those are the ones who are far ahead of the health curve. They are the ones who are telling us about treatments and different styles of exercise before that we even hear about them as therapists.
Okay.
And then in New Westminster and Coquitlam area, that is a group of people where I see there's so many people in that area, and many of the patients I see, they're working class people. They're doing so much with their work, taking care of their families, that to them, most of them don't get a chance to sit and examine their healthy habits or the exercises that they do and don't do until they're involved in an accident. And it's really unfortunate that I wouldn't say that it's because of where they live, but there's certain prevailing aspects of
So that's interesting. One group has got life priorities to deal with. Another group is actively budgeting and planning.
Exactly.
And another group is sort of perceived to be as wanting to know more about the range of health services.
Mm-hmm.
That's
but
interesting.
They don't have the best places to go.
Let's talk to Herbert in Vancouver. Have we got Herbert there, Adam?
Yes, right here.
Herbert, do you have a question for my guest, Anders?
Well, what'll I do? I have this consistent lower back pain, and it's just I can't do anything. I'm taking Tylenol, muscle aches, and body pain over-the-counter stuff, which I believe was suggested to me by a doctor quite a long time ago, but I haven't seen anyone since because circumstances, and I lost my wife, and oh God help me, and the pain just goes on, and I'd like to know what the hell I can do.
Let me ask you just briefly, Herbert. Have you seen a massage therapist or other practitioners before, or are you
No,
just primarily on the medication?
just on medication.
All right, then let's see what Anders has to offer, because this is fairly typical of patients that have had a diagnosis and a treatment, but they've only had one diagnosis, they've had only one form of treatment, which if it's effective, great. But here's an example of Herbert, which by my experience, and I suspect yours, is a more common story. So what do you have for Herbert?
Well, Herbert, the first question I would ask for you is, are there any particular activities
Pardon me, I can't hear you.
Okay, just a second. We'll make a slight adjustment here. Are you hearing me all right, Herbert?
Well, it's better, yeah, you got to talk pretty loud.
All right, we'll talk a little loud for you.
Yeah.
All right. So, Herbert, the first question I have is, are there any sort of activities that you find particularly difficult to do since you've had this back pain?
Well, I'm 94 years old, and I've worked my ass off all my life, and I lost my wife, and I'm alone, and I still have to look after her.
All right,
I looked after her, and now I'm looking after myself, and just the pain just is consistent, never goes away.
Okay. To me,
I take 2 of those Tylenols in the morning and 2 of them in the evening.
What would you recommend Herbert first start to do?
One of the things I think, Herbert, or at least I suggest, is for you to get into the habit of developing a daily set of movements. That is, when you wake up in the morning, before you even try taking the Tylenol, move your back around, turn left and right, move forward and backwards, just in a way that isn't necessarily hurting, but in a way that sort of keeps your body
And he
moving.
can do this sitting on the edge of the bed.
You can do the sitting on the edge of the bed. If it's too much while sitting, you can even do it while lying in bed, doing a few rolls left and right. And the idea is to try to get your body to move and to have that sort of sensation of movement.
Now, I suspect Herbert here needs a little bit of assessment by one of your colleagues. So
Absolutely.
How's Herbert going to approach this?
Well, Herbert...
Well, I've been putting up with it now for quite a while, and my wife just passed away, so now I'm alone, and so
You need some help there, Herbert.
I need...
All right, Herbert, I'll let you listen to what Anders is going to say, because we're also going to cover some transportation issues that I think is important to help you. All right, Herbert, so I'll let you listen to this part.
Okay.
So, Anders, tell us first. Now, Herbert, he's 94. He's told us that, so he's probably got some other arthritic things. He's got some stress because of his personal situations. This sounds like a person who probably needs an assessment from you, one of your colleagues.
Absolutely.
And it sounds like Herbert's going to need some sort of routine help. How's that going to work for him?
Well, the routine help, a lot of it really does depend on where he can go, who he can see. Considering Herbert's history, I'd hope that he'd be willing to go take a chance by seeing one of us, a registered massage therapist, if only to get an idea of what we can do to help. Because it sounds like he's definitely not feeling very confident about his ability to heal.
Now, the first thing, of course, is if Herbert doesn't already have a massage therapist, and I think he said he does not, then he can simply do what? Go to the phone book?
Going to the phone book, looking up massage therapists, going to the website massagetherapy.bc.ca, and there's a function for find an RMT.
Herbert's 94, so I'm going to guess he may not do a lot of time on the computer. So,
and I wish I had
Herbert,
the
if you're listening, you want to talk to any of your friends, acquaintances. You might even ask your medical doctor for a referral. But if anybody who wants to see a massage therapist, they can simply go into the phone book, look into any of the community information. Now, Herbert has got a couple of other interesting things here. He's 94, so Herbert's probably going to require a friend to drive him, or he can use the Handy Dart system.
Yes, he can.
Yeah, well, I did use the Handy Dart. I used it more when I went to see my wife, but more lately I've been just managing without it. But I know the Handy Dart, and I've got my number with them actually.
Okay, Herbert, I'm going to ask Anders to give you some specific information online while I'll let you listen in the background. Thanks for the call, Herbert. So, your profession now, Herbert is 94, and for anybody 85, 90 plus, what sort of special considerations are you going to have because of the fragility, osteoporosis, and in Herbert's case, clearly some chronic pain? And we're going to use Herbert as our example because I know that there are many men and women exactly in Herbert's situation.
One of the most important things that I want to stress is understanding that there's always options. If you don't feel that, if Herbert doesn't feel that he can head out and see one of our registered massage therapists in their own clinic, calling the Massage Therapist Association, the MTABC's phone line, can provide him access to a directory where there are certain subsets of RMTs that
They'll make a house call.
that do house calls.
Actually, why don't you give us the phone number right now for the Massage Therapy Association? Do you have that offhand?
I don't have that on me.
Okay,
but I was
we're
really
going to get
hoping
that.
we could get
I've actually
Michelle's
got it right
got it.
here. Yeah.
Beautiful.
Outstanding.
So to call the Massage Therapy Association of BC, it's 604-873-4467, or if you're out of the Greater Vancouver area, toll free, it's 1-888-413-4467. And of course, email inquiries can go to MTA, so Massage Therapy Association, MTA at massagetherapy.bc.ca.
Now, Michelle, for the benefit of Herbert and many, many others like Herbert, they're not going to write too quick. So give us that Vancouver area phone number again slowly, because I know for a fact there's many men and women that as they age, there's going to be chronic problems. And too frequently we dismiss people's too frequently we dismiss people's problems just because of their age and saying, oh, you're older, that you're such and such age, well, it's your age, it's arthritis. So let's give Herbert and the other people that same number again, because these are the people that want to phone this number to get a house call from a massage therapist.
Sure. So if you need to look for a massage therapist, you don't have access to the internet, local calls 604-873-4467.
Thanks, Michelle.
No problem.
Anders, what about voice dysfunction? Now, the voice dysfunction affects people in all careers, so you don't have to be sitting there tonight and saying, well, I'm not a singer. Well, you could be you all are talking, and for some people, voice dysfunction is something they're coping with because it's not necessarily an easy identifiable thing for an assessment or a diagnosis or treatment. And as you've pointed out, it could be someone who speaks for a living. That includes lawyers. Some people might say it includes me, and I need lots of speech therapy. But in any event, we're going to take a short break here. And when we come back, we're going to hear Anders Lau talk to us about voice dysfunction. He's also involved with martial arts and exercise. And we're going to ask him to explain some of the things that a massage therapist and some of his research has identified and how this may help you. You're listening to the Dr. Don Show live on AM 650.
There's lots more still ahead. This is the Astral Radio Network and the Dr. Don Show. It's your health. It's your life.